Hello, my name is Sonia Laurel, and I'm the Membership Director for the Illinois branch of the Association for Play Therapy. Today, I'm going to talk to you about the play therapy credentials and the process for getting these. There's actually three types of play therapy credentials: the Registered Play Therapist, RPT, Registered Play Therapist Supervisor, RPTS, and a School-Based Registered Play Therapist, the SB-RBT. Today, I'm just going to talk about the RPT. So there's four criteria for getting this credential. First, you need an educational degree, which is a master's or higher of a clinical mental health degree. You need a current and active license to provide independent clinical mental health services. You also need 150 hours of play therapy education. These can be completed at graduate school, a college, a university, or a play therapy continuing education center or workshops. Finally, you need 350 direct client contact hours under a supervision of an RPTS. There's certain core courses that need to be part of your degree that they'll be looking for when awarding your RPT. There needs to be a class on child development, so this could be lifespan development, human behavior, or social environment. Theories of personality, psychotherapy, skills such as micro skills or methods, and child and adolescent psychopathology. So courses that would meet this would be things like abnormal psychology, the DSM class, diagnosis and treatment course. And finally, a course on ethics. The play therapy instruction, which is 150 hours, needs to be broken up into certain categories. There needs to be at least 5 hours of play therapy history. There needs to be 55 hours of a seminal or historically significant play therapy theory. There also needs 50 hours of specific play therapy skills and methods, 25 hours of special topics such as special populations or burgeoning models, and then 15 hours are left to the applicant's choice. These are the seminal or historically significant theories that APT lists. So of the 55 hours that need to be, one of these can be on any of these kind of theories. The seminal theories are cognitive behavioral, humanistic, and psychodynamic. And the historically significant theories are listed there as well, including Adlerian, child-centered, developmental, and so on. So there's several ways to get your approved education of those 150 hours. There are Association for Play Therapy e-learning center, where there's audio and book offerings. There is play therapy continuing education workshops. So there is an online directory of continuing education trainings that is offered by the APT approved providers. There's also approved centers of play therapy that are designated to generate more play therapy research, peer-reviewed publications, instruction, supervisor training, and supervised clinical experiences at universities. Universities offer play therapy certificates and graduate courses that can meet these requirements. And finally, there's individual organizations and individual supervisors that have approved continuing education offerings as well. To learn more about what is available and what is approved, there's a website at a4pt.org under education training that can give you a list of these online directories. So one thing that's important about the registered play therapist credential is that it needs to be done in a 3-phase approach. So this means that there's direct instruction, the educational opportunities that are followed by periods of clinical cases and supervision. So there's actually 3 criteria verification forms for each of these phases that need to be filled out and approved along the way, or filled out by your supervisor along the way. So what this looks like is that for phase 1, you need to document 35 to 55 hours of instruction, and you need to be able to see 50 to 75 hours of direct play therapy experience under the supervision of an RPTS for at least 5 to 10 hours. At the second phase, it's similar, but it's the 55 to 70 hours with 100 to 150 play therapy hours of experience. And then document 10 to 15 hours of supervision. And you can see phase 3 is similar. You'll see also that there's needs to be at least 1 observation by the supervisor for phase 1 and 2 observations by your supervisor in phase 2 and 3. So the Association for Play Therapy really wants this to be an integrated experience of getting the RPT. So this means that the instruction, the clinical experience, and the supervision are integrated. And it means that the coursework and the education and the workshops that you get should be well-rounded and more than just one play therapy theory. And it also needs to be spread out over time. It can't be done within a few months. It needs to be spread out over at least 2 years, but not more than 7 years. And then supervision needs to be at a certain ratio as well, meaning that for every 10 hours of clinical experience, you should get 1 hour of supervision by the RPTS. So the benefits of getting the RPT really communicate to your colleagues and to the public about your competence and your experience and how you've really developed a specialty in working with children and using the powers of play that we know are so important. And before even getting the RPT, there's a lot of benefits in joining the Association for Play Therapy. There's discount rates for the local branch of the Illinois Association for Play Therapy if you join that branch. And there's also discount rates for the Association for Play Therapy's national conferences. There's also a discounted rate when you apply for the RPT. There's an access to membership directory, so you can find other registered play therapists in your area. There's also, you're able to stay up to date on what kind of training events are happening and be able to find those CEUs that are important. Even after you get your RPT, continuing education is important and must be done to uphold the credential. There's also great newsletters that come over email as well as mailings that come that are full of really good information. It's a great way to stay up on the latest research that's being done in play therapy, as well as in such as like this journal of the International Journal of Play Therapy send out quarterly information on what the research is going on. And then there's also the magazine Play Therapy that is sent out that has a lot of good specific information on specialized topics, such as this one where it's technology in the playroom, cultural competence, grief, specialized sort of topics that people write on and you can learn about and grow your expertise. And finally, networking opportunities. They're a way to meet local play therapists and build a community that you can learn and grow with. So I encourage you to be part of the play therapy community. And to join, there's a couple different ways you can find the ways to join at the Association for Play Therapy There's the membership page where you can join, and you can also find it through the Illinois Association for Play Therapy website. And you can join the Illinois branch when you join the national organization, so you can stay connected to us locally. If you have any other questions, please reach out to us through the website, and we're happy to answer questions. And we look forward to seeing you and you joining our community. Thank you.